What if one of nursing's newest buzzwords is also one of its most controversial? Should nurses see patients as individuals or as members of social groups? Can you truly provide patient-centered care if you begin with assumptions based on demographics? Is social justice just another word for compassion, or is it an entirely different philosophy? Have we confused advocacy with activism? Find out on this episode of the Earn It Podcast. The first challenge is that everyone seems to define social justice differently. Some define it as reducing health disparities. Others describe it as addressing systemic inequalities. Others see it as advocacy for marginalized populations. Still, others connect it to broader political or philosophical movements. For today's discussion, I'm talking about social justice as a framework that encourages nurses to understand health through the lens of group disparities and systemic inequities. Now, here's my first question. Why? Because nursing already has a framework, right? And it's called the nursing process. In nursing school, it is drilled in our heads. ADPI. Assess, diagnose, plan, implement, and evaluate. Do you notice something, though? Every step starts with the patient, not the patient's race, not the patient's socioeconomic status, not the patient's political identity. The patient, an individual human being sitting in front of you. And here is the heart of my argument. Good nursing treats every patient as an individual, not as a representative group. Every patient deserves a complete assessment. Every patient deserves curiosity. Every patient deserves to be asked questions instead of having answers assumed for them. Let's say transportation is a barrier. Should we only ask certain populations whether they have reliable transportation? No, of course we shouldn't. We ask everyone. What about food security? We should ask everyone. What about health literacy? We should assess that for everyone. What about financial concerns? Everyone. Housing instability, mental health, social support. Everyone. Do you notice the pattern here? The standard of care shouldn't change depending on who walks through the door or who you're talking to. The assessment should change. The findings should change. The plan should be different, right? The patient-centered nursing model. It is what is simultaneously taught alongside social justice in a lot of different nursing programs, and that's what I have a problem with. Now, here's where some might disagree. They'll say, but certain groups experience these barriers at higher rates. Well, now that's true. Population-level statistics can be incredibly valuable. Public health relies on them. Hospital administrators rely on them. Researchers rely on them. But bedside nurses, we don't really care for these statistics that much because we should be caring for the individual. Statistics might tell us what might be common, but assessment tells us what is true for the patient that's right in front of us, and those are not the same thing. Now let's talk about cultural competent care. Culturally competent care is a really important distinction to make from social justice. This is why I have a problem with social justice being gallivanted around and being taught in general. Cultural competence, right? This is another place where I think people might sometimes blur concepts together. Traditional cultural competence doesn't tell the nurse to assume what patients believe because of their religion or race or culture. You see, a lot of people might think that culturally competent care means you need to educate yourself on different cultures and religions and ethnicities and what things that each one of those groups have in common, what different characteristics are of each, and what are some kind of ways that you need to change your care or approach a patient or a patient's family based on that. However, culturally competent care warns against doing that. So simultaneously, we should be educating ourselves on different cultures and what some cultural differences are, but we should not assume that specific health decisions are going to be made or specific accommodations should be made based on our assumptions of a known race, religion, or culture of our patient. Okay? Culturally competent care warns against that. It encourages nurses to learn about different cultures, to ask respectful questions, to understand potential influences on healthcare decisions. But then we need to verify these things, not to assume these things. And that is an important distinction. Knowledge shouldn't cascade into stereotyping, right? Awareness is not assumption in this case. Good cultural competence says this may influence the patient's decision, but good nursing says I'm going to ask about this. Okay? Social justice, at least, it's often presented, shifts more attention towards the groups and the systems. And my question is really simple. If cultural competence and individualized assessment already teaches nurses to identify barriers without stereotyping patients, what unique clinical benefit does social justice provide? Now, this brings me to graduate nursing education. I see a lot of ads all the time, all over LinkedIn, with different NP programs, DNP programs, whatever. DNP programs are probably the most advertised. Not a lot of people really advertise their master's degree or their doctorate degree in like nursing education or anything like that. By the time someone enters a master's or doctoral nursing program, they should already know how to provide patient-centered care. They should already know how to advocate, identify barriers. They should already know how to assess social needs. These are not advanced concepts. These are foundational nursing skills. So when I see graduate nursing programs prominently advertising social justice, I can't help but ask why that is. Shouldn't graduate education be focused on advanced assessment, leadership, maybe evidence-based practice, research, education, more advanced pharmacology, maybe some more advanced clinical decision-making? If social justice is just being, highlighted as something distinctive, then I think it's fair to ask what it contributes beyond competencies that every nurse should already possess. Let's talk about some of the pushback to this, okay? I want to be fair here. Their supporters of social justice would probably say some things back to this, right? They'd probably say I'm missing the point. Social justice isn't about making assumptions about patients. It's just about changing systems that create unequal health outcomes. This is one of the most common counter-arguments against this, and obviously part of it I agree with. Nurses should absolutely advocate for better systems, but by being a better part of that system. And, such as if a patient can't afford medications, we should help facilitate changing that so that a patient can get the medication. We should advocate. If a patient has transportation issues, we should advocate. If discharge planning is not adequate, we should advocate. I have been a part of this personally before. Advocacy is just a part of nursing, but here's why I think we part ways, okay? Where I think we part ways is I don't believe nurses need a separate social justice framework to justify that advocacy. Our profession already has ethical principles that support that. Beneficence, justice, non-malfeasance, respect for persons, patient advocacy. Does this sound familiar to nursing students that have finished first semester of nursing school? It should. These principles already tell us to improve patient care and remove barriers. So again, I ask, what does social justice uniquely add? If the answer is simply identifying barriers and advocating for patients, then nursing has been doing that for decades. If it adds something different, then let's clearly define what that is and discuss whether it belongs in nursing education. Because I don't think if it does provide anything else that it's useful. I think if anything, it introduces the justification for some people to have assumptions of individuals based on group characteristics, right? So what I'm trying to say here is when you have a patient in front of you, that patient should be to you an individual patient, no matter what color their skin is, no matter if they're talking with an accent or they can't speak your language, wherever you are in the world. That person is still an individual. If you are finding yourself immediately taking that person and trying to categorize this person And then you're attributing different characteristics based on your quote unquote knowledge of various cultures, religions, races, as far as common barriers, etc. If you're automatically doing all that and you're going to from there direct your care in a specific direction, you're going to direct your questions in a specific direction, that means that you're directing care and directing questions away from potentials that could exist outside the characteristics that you attributed to that individual. Because you are grouping that person into these groups that are really focused on in social justice frameworks. This is what I have a problem with, and this is what you should have a problem with. The funny part is we are taught patient-centered care and at the same time taught about how important groups are and how different things affect different groups of individuals, okay? And then we should be grouping individuals into those groups. Now, again, I know a lot of social justice advocates are saying we do not group individuals, but you do, because the whole point of social justice is that we are looking to remove barriers or change outcomes, okay, based on different characteristics that are in a lot of cases unchangeable. And whether they're unchangeable or not, it doesn't really matter. It could be. The issue is that there are a lot of unchangeable characteristics, that are presented as unchangeable characteristics, such as poverty, right? Poverty is a big one. It's one of the defining factors of how someone's healthcare outcomes are going to be. Because when you are in poverty, you're focused on survival more than you're focused on specific health outcomes. And I understand that this needs to be taught in a lot of nursing programs, but this is not social justice. This is simple population health. This is because not every nurse, before becoming a nurse, not everyone has experienced poverty. This has been part of the job and I usually don't get personal in my podcasts, but this is one area that I really understand and even I forgot about. Let me explain this a little bit. I grew up in a very small kind of city, Gadsden, Alabama, for the most part. Like most of my childhood, like after 13, before that, I was in Florida. Both situations are the same. The issue is I was raised by a single mother that didn't have child support. And even though she didn't make that much money, she was expected to have housing for me, food, school, clothes, all of the things, right? But even though she made minimum wage, at least at the time, she quote unquote made too much most of the time, even though she was literally making minimum wage, to get things like food stamps, to get things like Medicaid. So a lot of my childhood, I was uninsured. And a lot of my childhood, we had food insecurity. And there were points in my childhood where I, went to school and that was the only place that I was able to get a meal. And it was particularly difficult in the times where, again, even though we couldn't really afford the things, the government said that we could. So there were times where not only did we not get SNAP benefits, my single mother and I making minimum wage while she's paying all of the bills and all the housing, okay? But when I go to school, we didn't qualify. There were times where I didn't qualify for free school lunches. But also my mom could not afford to pay for my school lunches. So there were even times where we couldn't really afford quality food or a substantial amount of food, or, there were meals missed, let's just say. And there were times when I went to school, and of course they let you quote unquote borrow, whatever that means. That basically means you run up, a debt, right? And so that would happen, but only up till a certain point. They only let you borrow up to a certain point, okay? And then you can no longer get lunch. Now you're at school all day. You can't get lunch. You're not going to get food when you go home later. You didn't get food that morning. You have class just like everybody else. You have PE just like everybody else, right? And not only that, whenever things go to change again, now there's some kind of balance that my mom definitely couldn't afford. And, this was the way that I was used to living. A meal sometimes did consist of ramen noodles that were straight out of the package, not cooked, because also at times we couldn't afford for our power to be on. There was issues affording gas for my mother to go to work, and then there were further issues with pay. There were one year my grandmother and my mom bought me an 88 key keyboard. It was great for me. I had a guitar given to me at one point. Both of those things had to be sold to a pawn shop so that we can eat. I understand the need to teach some of these things because a lot of people do not experience these things that are going through a nursing program with me. I know that was a little bit more information than a lot of you care to know about, but I understand why we need to learn these things is the point. You need to understand how someone not having enough money could be the reason why they're not going through with medical advice given, or they don't have health insurance, so they're not doing checkups regularly. Or even if they do, it doesn't mean that they have transportation to get to and from, because basically they have to choose. Do I need to go to the grocery store to get some groceries, or do I need to go to the doctor's office? Because I can't do both with my limited amount of money for transportation. This is not social justice. Social justice would have us walk into a doctor's office as white people, and nobody would be asking us these things. That's the point. Social justice would miss so many situations that if a patient does not volunteer their situation, you may miss that part of the assessment because you might assume that you don't have any issues there. Now, I understand built into a lot of different charting systems, when you maybe go into the hospital, you get admitted, there are questions that are asked to everyone to kind of combat this. And this is not a social justice effort changing inequities, okay, which I hate the word inequities, but I won't go there in this episode. This is just making the healthcare system work better. It has nothing to do with social justice. It has nothing to do with groups of individuals. The point is that there needs to be some questions that we ask everyone. There needs to be no questions that we're only asking certain people based on our judgments of their physical appearance or their smell or what they're wearing or how late they were to their appointments or what they're coming into the hospital for. These are assumptions. Assumptions lead into stereotypes, whether you're doing it for good purposes or not. Now, not in all cases. I'm going to obviously bring up there's some medical things that do affect different folks with different genetic makeup, right? So there was a lot of discussion about African American individuals needing things like thiazide drugs for blood pressure treatment and may not respond to maybe ACE inhibitors or beta blockers. And so a lot of African Americans were being treated with medications that weren't treating their blood pressure, and they found out there was there are genetic variants that are more common in that group of people. That being said, there are still plenty of people with that, basically, in other words, there are still some people with that same color skin, but they might respond to the ACE inhibitor. So there's two things. Kind of goes to my core argument against social justice. This still isn't universal to all African Americans. Individuals that belong to this race do still, in cases, respond to ACE inhibitors. And another point, either way, this is just medical knowledge. This is not social justice and has nothing to do with social justice. We do studies and we observe data, we collect data, we analyze data, we respond to data, not groups of individuals. And I understand that there are data on groups of individuals. But again, at the end of the day, Nursing should remain centered on one fundamental principle: the patient in front of you, not the population they say that statistically resemble, not the demographic category they fit into, not the assumptions that come with labels, the actual person, their story. Ask the questions, identify their barriers, respect their values, advocate for their needs. That's what patient-centered nursing has always been. And maybe that's the question we should leave you with today, right? If every competent nurse should already assess barriers, advocate for patients, practice cultural humility, and provide individualized care, what does social justice add that nursing doesn't already require? I would love to hear thoughts in the comments. Do you think social justice is an essential part of modern nursing, or do you think patient-centered care already provides everything nurses need? Thank you so much for listening to another episode of the Earn It Podcast. Earn It Podcast is on Spotify, YouTube, and Apple Podcasts. Depending on where you're listening from, follow, subscribe, comment, like, and most importantly, share. There is a link to my LinkedIn in the description of the podcast, so feel free to reach out if you have questions or if you would like to come on and have a discussion. Again, thanks so much for listening. Go out there and earn it today.